Right. So, mm, okay. I hope everyone can take this course. Although this course have a prerequisite, so we everyone from the class able to take uh, this course. For those who having an issue to register or anything, you just can contact me personally. Yeah. Right. This course is generally it's about introduction. It's about introduction on the wildlife and exotic animal medicine. It's a very brief, a very basic course. Will give you an overview, a basic uh, on the certain management of diseases for a certain selected species. We cover many because uh, species. So just make a selection, just a selected species and selected diseases. And this course also have some topic on the basic management of wildlife, some part of conservation, some part of biology of animals. This course will be taught by myself, uh, Prof. Jalila, Dr. Tengku Rinalfi, Dr. Nur Fazila, and also Dr. Ruben. Okay, I am the coordinator for the group one, and Prof. Jalila is a coordinator for group two. So that's why I'm asking just now, since you are still not coming to UPM, so throughout this course, we'll be conducting through virtual online lah, online lecture. Okay. Um, so our schedule will be every Monday morning lah, 8 to 10. But it's subjected to any changes by a particular lecturer if they have some issues, some problems to conduct on that day. So you can negotiate with them when to replace the class. I think shouldn't be issue if we conduct online. Okay. Uh, this is the schedule. Okay. Uh, Today will be just introduction class, and then next week will followed by a wildlife biodiversity and conservation medicine by Dr. Ruben, and then wildlife management by Tengku Rinalfi, and then followed by myself on the immobilization technique in exotic and wildlife animals, which is consists of physical and chemical restraint. And then diseases of rodent and small exotic mammals. This one normally I cover mostly rabbit disease because rabbit are the most common species that people kept as a pet. But of course, we introduce some diseases of some small mammals like sugar glider and so on. And then diseases of non-human primates, diseases of wild ungulates and elephants. This one I will be focusing more on elephants because ungulates, as you know, ungulates they have so many species. Wild cattle, cow, deer. So all this you can learn after this on the subject ruminant medicine. More or less, uh, ruminant medicine they are related to the diseases of ungulates, wild ungulates. So that's why I'm focusing more on elephants. And then biology and management of rodents by Dr. Nur Fazila, management and diseases of wild birds by Prof. Jalila, reptiles disease by Dr. Ruben, zoonotic disease by Dr. Ruben, and then for the last two topics, common surgical procedure in selected exotic animals, which is consists of some procedure, mainly small mammals lah, small mammal surgery and reptile surgery, and preventive medicine for wildlife and exotic animals. Right. So the assessment methods, previously we only have kerja khusus or coursework, which is consists only test 1 and test 2, which covering 60%, and then followed by an exam. But I changed from year to year. I changed, in this coursework, I include more like quizzes and as well as student-centered learning, which is mainly the group assignment. Okay, because I realized that if you put a high percentage of ujian 1 and ujian 2, so 30%, it will be, you know, it will affected if you are not performing well. Okay, so I try to dilute the coursework, become can have more variation in terms of assessment. So we're going to have a test 1 20%, test 2 20%, quizzes 10%, and assignment 10%. It's a group assignment. It's a group assignment. So normally this group assignment I will be give it to you after the first test, and you need to submit before the before the final, before the study week, before study week. So these are some references that you can refer to. Uh, if you manage, I would encourage you to register to this Laughable Vet online website. I'm not sure whether as a student you can register to get a full access. I think yes, you just need to register. Laughable Vet is a very good online or website that you can refer. It cover all the exotic animals, birds. So this is a very good reference. All right. Just to give an overview, uh, why actually this course was started way back in 2010. So just a new subject. So during my time, I graduated in 2005. We don't have this course. We don't have any exposure to exotic exotic or wildlife disease. So after we graduated, we don't have any idea about how to treat, how to manage. You are lucky because we have been, I mean, at least we have some introduction. We give you some basic knowledge on the exotic animal medicine. So why we introduce this course? Because we realize that in the community, especially in Malaysia, is gaining in the people keeping this exotic animal. People like to keep exotic animal. If you go to pet shop, you can see many exotic animals they are selling, kan, hamsters, tortoises. So this gaining popularity is because they are exotic. People like something different, they like something different. Kalau selama ni just a cat, dogs, but then when it come to exotic, there are so much interesting species lah. Okay, so they are variation, they are so exotic. And as I said, availability in pet shop. You go anywhere in pet shop. In fact, you go to apa tu, mana-mana sometimes market pun ada jual. And then influences by prominent peoples, by artists, by influencers, by VVIP. So some of the VIP, I mean artists lah. I mean, okay. So where they get this so-called exotic or wild animals? Perhaps they do a captive breeding. There's some people do captive breeding. For information, for wildlife species, most of the wildlife species, especially indigenous, which is wildlife in Malaysia, they are all protected. So for those who want to do a captive breeding, they must have a license. They must have a license. Wild harvested, wild harvested meaning that either illegal or legal or illegal lah. They go to the jungle, then they capture wildlife. Pet store, online also you can get it. You can go search lah online, macam-macam ada. Facebook apa mesti ada orang jual online. Okay, but the owner education, normally most of the owner they don't have they don't have a specific or what we call official training or whatever education on how to keep this exotic or wildlife. Normally they self-learning by their own experience or by Googling, by their own reading. Right. In terms of wildlife and exotic medicine, I categorize into three category lah. Number one, exotic companion animal medicine, which is normally what I'm doing right now. Beside lecturing, I'm also doing on the case in our hospital, in our unit. Zoological medicine, basically for those who working with in zoo, in apa tu, petting zoo, and then wildlife or free range medicine. This one normally people who are working closely or people are working in macam people in perhilitan, like people in Sabah Wildlife Department, Sarawak Forestry Department, which is they are working with the real wildlife animal. But the roles are the same. Number one, for the health of animal, for the human health and safety, to give education to the owner. And as you aware that in our DVM course, actually the main business is actually small animal, livestock. That's our main aim lah for the DVM. For exotic wildlife, it's a minor practice. It's just minor business lah. But if you can include this exotic in your practice, it will enhance your reputation as well as economic implications lah. Because as you know, as I mentioned, the exotic keeping exotic is gaining from time to time. And also animal advocate. We also partly involved in the to take care of welfare of the animal. So what are the issues or challenges exotic and wildlife? Number one, if you are exotic or wildlife vets, dealing with this animal is not easy. Normally, you are dealing with owner, with the client knowledge. They have a very poor or minimal knowledge. They just buy the animal, get the animal, but they don't have a close contact. They don't have a proper monitoring. Some of the client they just put in the cage without without touch the animal, without doing anything. Just put it in the cage, change the bedding, change everything, put a feeding, but they don't have a close contact. They don't have a soft touch. So sometimes when we ask further history, they don't have any idea. Okay. Basic knowledge on exotic animal medicine. As I mentioned, you are lucky at least you have some introduction on these common problems, common disease in exotic. Lack or no experience, of course, during your years in DVM, you don't have so much exposure to wildlife and exotic cases of practice. So when you go out, of course, you don't have much experience unless you have your own initiative to go for practical in the zoo, in exotic, in any clinic that practice exotic medicine. And the other issue is handling safety issue. Most of the exotic animals, most wildlife animals, they are anxious. They are difficult to restrain. They are highly stressed animal, and some of them they are very dangerous. Okay. Don't talk about big mammal. Just talk about like small mammal. For example, macam rabbits. Rabbits, mungkin we say that nothing. Well, it's easy to handle, but in reality, no. It's not easy. It's not easy to handle rodents, especially rabbits, guinea pigs, hamsters. They are highly stressed animal. they are, they are, I mean, physiologically, I mean, they are prey animals, so they are highly stressed. So sometimes, uh, when they are prey animal, they are able to hide their problems, their disease. When it come to us, already at the terminal stage. So when we handling stress and so on, they can lead to further problems. Okay. In terms of zoological medicine in Malaysia, we have a public zoo, we have a private zoo. Public zoo ni macam Taiping Zoo, apa, Maman Zoo, mana lagi? Melaka Zoo, that's a public zoo. Private, it's like zoo negara, apa lagi ya? Zoo negara, kalau petting zoo macam farm in the city, Sunway, all those are private lah. All these zoo and petting zoo, they are supported by organizations, mainly in Malaysia by Perhentian. All these all these premises should get a license, or we call a permit to run their business. Okay, if they don't have the permit, they cannot display, they cannot run their zoo. Okay, and normally government base or public zoo, normally they are supported by government lah, government or local agency in terms of funding and so on. But for private, they are mostly they are depends on the funds, donations and volunteers punya ni lah, support. Okay, for your information, all these zoos or petting zoos, they cannot buy the animal. Cannot buy. There's no such thing of buying wildlife animals. Unless for exotic. Exotic is different thing. For wildlife, they cannot buy the animal. They can get the animal either by trading or exchange program. Okay? For example, Zoo Negara has many orangutan, for example. So they can ask, for example, Zoo Melaka can ask Zoo Negara to loan or to exchange the animal. Perhaps orangutan change with tape, for example. So that's one kind of thing lah, how to get the animal. Loan program, wildlife translocation. This one, they can get a permission by Perhentian to capture the real wildlife in the wild area. But then if they have surplus, so they can release back to the this is subjected. This is applicable to only local species lah. Okay, for example, macam in some zoo they have so many macaques, long tail macaques, for example. So they can the surplus they can release back to the wild, to the selected area that they have identified. All the enclosures should have a minimum standard requirement by the Perhentian or WAZA. It's a World Aquarium and Zoological Association. If they don't meet this criteria, normally the Perhentian won't give or suspend their license or permit to run their business. Okay, and zoo actually they not just depends in terms of medicine, in terms of health, not just depends on the veterinarian. Actually, uh, I would say that most of the thing it depends on the train keeper. The keeper, they are close to animal every day. They are taking care of the animal. They are the one who first notify if the animal having a problems. Okay, just imagine we have 1,000. I would say that, for example, in Zunaga they have 1,000 of animals. Okay, 1,000 of animals. So it's difficult for vets to do a daily routine check all animals. Normally they have to depends on the train keeper. When the keeper complains something, then the vet can intervene. Okay, issues in zoo, normally they have problem in funding for animal health. Normally, majority of their fund devoted to uh, for apa tu feeding, feed and feeding, more on management. Feeding incur high cost for all the running business cost lah. Okay, that's why they have problems to provide more education to the health, to the medicine part. Okay, reluctant to fund preventive medicine. As I mentioned, you have 1,000 of animals. Yalah, just imagine uh, wild ungulate, for example. They have macam-macam lah gaul, they have bali cattle, whatever, deer, so many deer. For example, if you want to vaccine, for example, for whatever FMD, KHS, that's a lot. Okay, that's why sometimes they refuse to do this preventive medicine. Same thing for deworming kan, too many animals. Medical issues influenced by external factors, resistant to standard quarantine procedure and high risk. So when working with exotic wildlife ni, is a high risk. You have to have a extra careful. If not, you will end up with all this thing. Okay, end up with yalah, like for example, snake bites, escape of wild animals. I remember uh, in Zunegara pun a few times lah, escape of animals, escape of even they apa tu last year, if I'm mistaken, cheetah was escaped. And in fact, Zoo Taiping pun recently, I mean last year lah maybe, if I'm mistaken lah, tiger kan escape from the zoo. So all this is very dangerous, very high risk. Not dangerous to the staff, also dangerous to the public. Okay, I think this case, the crocodile, you can see the hand. This is the hand of, I think, the vets. I can't remember, this is in Taiwan or where. This one, not mistaken, the vet is trying to immobilize or sedate or tranquilize the apa tu, the crocodile. But of course, after the giving the injection, the animal looks stable. But I don't know how the vets. I think the vets trying to check to make sure whether the animal already sedated. But maybe he went too close with the animal and the animal actually bite his hand. But luckily, if I'm mistaken, the medical doctors surgeon able to put back the hand of this vet. Okay. And this one is this my leg. Okay, this is my leg. Uh, uh, Way back in 2005. I'm just working with Zunegara at that time. 3 months after that, I was the reticulated python bite my legs. So I got 10 stitches here. It's a massive bleeding, a lot of blood loss. So very, very dangerous. Very dangerous. If you are not able or you are not comfortable to handle the animal, don't handle that. Leave it to for those who are more experienced. Okay, so beside this course, actually, there are so many continuing education that you need to for those who interested in this field, you have to further explore the knowledge by there are so many options here you can have. Like we have so many professional organization that you can join. You can, from the organization, they handle so many events, so you can learn from that. In the regional, we have a CISA, I mean local, sorry, regional, we have CISA, for example. CISA is a Southeast Asian South Asian Zoological Association, I think. Then we have Asian, and then we have a global American and so on. And luckily, in Malaysia right now, we have a WFSIC. It's a wildlife exotic wildlife, exotic veterinarian, special interest group. If not mistaken, it's already registered. It's already registered. Okay. This is a community. It's a community in Malaysia, community of wildlife and exotic veterinarian. It's involved uh, many people that who are working with exotic animals and wildlife. So you need to join many ni lah. We have some internship program, residency and workshop lah. Okay. Like residency is actually it's a very specific course lah. This one, not all university offer this course. Normally, it is offered in US mostly lah, in US and UK. Okay. So there are so many books you can refer, journals, website, and also you can refer to senior field wildlife veterinarian lah. Like myself as well, if I don't have if I'm facing some problems, I will call many people out there. They are able to help you. Okay. Okay. Being a zoo veterinarian, okay. As I mentioned, we have a government and private wildlife park and zoo. So meaning that you can work either in the government sector or private sector. But the problem is the field is very competitive. Because we don't have so many zoos in Malaysia. Kan? It's very limited. And then the number of vet also for each zoo also limited. For example, Zoo Negara right now they have 1, 2, 3, 4. So they have only 4 vets and they said they don't take more than that. Huh? Excitement working with exotic. So it's a good things. But the problem is you cannot be specific. So meaning that there's so many species. No, it's not like you are dealing with small animal. For small animal disease, for example, small animal medicine, we have only cats and dogs. Okay, but in wildlife exotic, you have to know many things, many species, not just many species, but so many diseases, so many problems that you have to know. So that's why I said you cannot be specific. You only know the general knowledge. And then if you're working with wildlife, you have to face with working with irregular hours working and as well as weekend duty. One applicable, for example, for those who works with uh, I mean natural wildlife, for example, like wildlife department, Sabah wildlife department, they are working. In fact, after office hours, they are still working. Variety, experience, exposure in daily tasks. Of course lah, bila you work with many species, many animals, so the variety of experience lah. But at the same time, you face with a potential danger in working with animals. Alright. Diagnostic and therapeutic challenges. Wildlife and exotic, they are different from domestic animals. But most of the thing, we use the basic knowledge of general medicine. Okay? You work with, although they are, well, for example, you learn about small animal medicine, cats and dogs. It can be applicable to any species that related to feline or canine. You learn about feline medicine, okay? So you can apply that knowledge to the feline, exotic or feline wildlife. For example, tiger, lion, and so on. Okay. Same thing with you learn ruminant medicine. You can apply that knowledge to treat or to manage the similar species. For example, for ruminant, you can apply that knowledge for gaur or seladang and so on. Deer. Same thing you learn about horses, equine medicine. You can apply that knowledge to the similar species, which is like elephant. Okay, so you can apply the same knowledge. But beyond this knowledge, you have to do a more reading. You have to experience it, and you need a lot of creativity lah in terms of how to give drug, how to to do examination, how to check. It's not difficult because it's difficult. It's difficult to handle animal. So you need your creativity, how to perform all those clinical techniques, clinical medicine. Okay. Okay, as I mentioned, it's difficulty to assess because the animal is danger, fear, and stress. And then it's difficult to get all those kan macam kucing, anjing, cats and dog. It's not a problem to get their temperature. It's not difficult to get their heart rate. It's not difficult to get their respiratory rate. But for wildlife, not even you can handle pun. You tak boleh handle pun. Then how you want to get uh, dia punya temperature, for example. So maybe that's why I said you need to have a creativity. Okay? Maybe from a distance you can think of something that infrared long distance temperature measurement. I don't know, kan, macam some applicable dekat human kan, dekat airport kan kita ada apa tu yalah, dia panggil apa, infrared what so on lah kan, yang boleh check without close contact with the animal. And then exotic wildlife ni they don't like anything that you apply to them. So respond to it for object ni, they don't like. You put suture, you put bandage, you put everything, they're trying to remove. Okay. Delivery system need creativity. That's why I said how to give oral medication, how to give injection, how to give IM medication, because you cannot handle them. So you need a creativity. Maybe the oral drug you put in the food, you put in the water, something like that. Problems in determining or calculating drug dose. Kan? Let's say you want to an elephant having a problem, you want to give a medication, but you need to calculate the drugs, but you don't have any idea how to measure the body weight. You don't have that. You don't have a apa tu, weight scale kan. So you have to do a body weight estimation, so on. Okay. If you are working with free range wildlife, much more challenges because they are free in the wild. So how to assess the health of this wildlife population? So the answer is very, very difficult. Very difficult. That's why we end up with so many things, so many diseases recently. Macam-macam SARS coronavirus, MERS coronavirus, macam-macam. Yeah. So it's not easy to monitor their disease, their health. But for assessing health in wildlife, we have two options. One is active surveillance and second is passive. Active is quite difficult. In the active, something that you go to the jungle, capture wildlife, monitor their problem. So it's not easy. Kan? In Malaysia, nak monitor for example lah, diseases of tiger. So you need to capture the tiger first. To capture pun it's not easy kan? You need a lot of manpower, you need a lot of funding, so on. Passive surveillance ni is about much more easier compared to active, which is you depends on based on die off, meaning that you found animal die on the roadkill accident, apa semua tu kan, and then you can monitor from that lah. Okay, treatment is too difficult lah. In free ranging, in truly wildlife is too difficult. It's too difficult. So that's why perhaps if prevention is a better option as compared to treatment. So prevention pun is quite tricky jugalah. How to, takkan you nak, for example, vaccination kan. It's not easy to vaccine wildlife in the real wild situation. So, itulah. Okay, we can seek option. For example, instead of vaccination, we do a zoning, separate. Try to confine the wildlife in their area only, without contact without coming close to human settlement. As I said, vaccination can be done, but it's very, very expensive and required huge effort. And kan, you kena fikir juga how to give vaccination pula, how to give a vaccination to a wildlife animal. Okay. Alright, just to give some idea, to brief you, uh, uh, scenario in Malaysia, who are person or people that normally uh, handling cases of exotic and wildlife. Maybe not all. I just introduce some people that I know lah. So in our UH, we have our team. We call AVEX. It's avian and exotic. So mostly this unit only dealing with wild birds or petting birds as well as exotic animals, including wildlife lah. So we are dealing with exotic pets, rodents, rabbits, hamsters, guinea pigs, reptiles, tortoise, apa semua lah. Okay. And wildlife depends lah, kalau kita ada cases from zoos, normally we go there or they bring the animal to us. Banyaklah kita contact dengan zoo negara, zoo Melaka, Aquaria pun kita ada banyak case. So this team, kita ada vet, myself, normally for exotic lah. I normally handle exotic. Prof Jadila mainly for avian or wild birds. And we have VO lah, Dr. Shima, Dr. Shahira, Dr. Azim, Dr. Wan, and currently we have Dr. Lokman. Dr. Nick also handle the avian lah, mostly related to wild poultry lah. Wild poultry, not wild birds. They are supporting staff lah. Chicken dah tak ada. Chicken actually dah resign. Dia dah buka klinik dekat Johor. She also focusing on exotic lah in her clinics. Okay, and then the other peoples, they are much involved in the research lah in the faculty, which is they are much interested in wildlife research. For example, Dr. Ruben banyak buat macaques, banyak buat pasal malaria, parasites, renal life conservation lah, management. Fandi pun sama juga, lebih kepada wildlife management, physiology. Dr. Mark lebih kepada Dr. Mark and Dr. Wan Fitri more on reproduction lah, reproduction study in wildlife. And then in the perhiritan wildlife department, we have many vets. Maybe not all I've listed here, but these are people that I commonly work with them. Dr. Doni, Dr. Doni based in HQ. Currently, Dr. Doni is doing his master in faculty under Dr. Mark. He's doing on the reproduction study lah on the Malayan tape. So he's going to be an expert in Malayan tape. Dr. Firdaus. Dr. Firdaus actually is based in Ganda. He's expert in elephant. Dr. Zubaidah, she has a much experience on wildlife rescue. She's now in the dekat Sungkai Wildlife National Rescue tu ya. Sama dengan Dr. Suzana dekat Wildlife Rescue. And then Dr. Anna Maria, and then currently ada baru masuk, tapi she's a senior in DBS, but ditransfer to Perhiritan Hamidah. So they are all rounders, meaning that they can go anywhere. If, for example, got problem, got an animal rescue dekat Terengganu, so they will deploy all these vets lah. It helps in terms of capture, treatment and so on. And then kalau kat sebelah Borneo kita ada Sabah Wildlife Department, and ada Sabah Wildlife, ada Wildlife Rescue Unit headed by Dr. Dr. Sen. Dan kita ada Rupen, apa nama dia? Ingat dah. Dekat ni kan dia Sambil punya ni Conservation Center. Okay. Zoo Taiping kita ada Dr. Kevin, is very senior vets. And then currently dia ada junior vet lah, Dr. Ridwan. Not junior lah, tapi also experienced vets lah. Okay. Dr. Valen dekat Zoom Melaka. Tapi ada seorang lagi, I tak ingat. Is a Malay vets. I can't remember his name and couldn't get his image. Last year we had last year or early this year, last year lah, we had a program, a TB program, tuberculosis program dekat dia punya primates in Zoo Melaka. So Zoo Negara currently, as I mentioned, they have 4 vets, Chief Vet Dr. Naim and Dr. Likai, Dr. Su and Dr. Senior Dr. Kavita. So they have 4 vets currently. And previously ramai lah yang previously ramai dah pernah kerja dengan Zoo lah. Maybe you know Dr. Belayan, Dr. Abraham sekarang dekat Singapore Zoo. Dr. Vijay now doing more ruminants works. Dr. Reza, I can't remember Dr. Reza dekat mana sekarang. Okay. Dr. Sarah, sekarang dekat Aquaria I think. Dia buat freelance dekat Aquaria. Dr. Reza, myself pernah kerja dekat Zoo and Dr. Felix. And many others. This one mostly private lah, private dekat Bonus Sambil ada Dr. siapa nama? Oh dah lupa. Lepas tu dekat Sunway ada orang sekarang ni, ada Dr. Senior One, Dr. Eve, siapa nama dia? Cuni, siapa tak ingat nama dia. Dan Dr. Bong dekat Eva Musa and Dr. Sabah dekat Orangutan Perak. This is Dr. Sandy. Sandy sekarang dekat UMK lah. It's a lecturer in UMK. And it's also it's an experience. She has many experience in wildlife because before joining the UMK, she's a vet under the Perhutian and Zoo Melaka. Alright, this is one of the entity that working with wildlife in Sabah. It's the Borneo Rhino Alliance, or also known as a BORA. They are focusing, last time they are focusing more on Sumatran rhino, but unfortunately, as you know that all the captive rhino already no more in the captive, so now they are working more towards mammals lah, more on the conservation of mammals in Sabah. Okay, so in our for those who are working with wildlife exotic, we have so many activities. Beside the clinical works, we also involved in research, attended workshop and so on. So these are some example of the clinical case that we attended lah. Okay. Remember this one we did with Prof Wahid, we did ultrasound because suspect this elephant dekat Zoo Negara suspect pregnant, so we did ultrasound. And then this is a postmortem of Malayan Tape, postmortem of orangutan. Okay. This is I did euthanasia. Sadly, I have to do that because this Malayan tiger suffered from a chronic leptospirosis. So at the end, after 2 years, we decided to euthanize this Malayan Tape. You see how skinny, how emaciated the tiger. And this is postmortem of anaconda. Maybe you heard somewhere in 2006, I remember exactly, where one snake sanctuary in Negeri Sembilan, Ulu Bendul, they suffered from outbreak of inclusion body disease. It's one of the important disease in reptiles, especially in snakes lah. Inclusion body disease, IBD. Yes, now they this one Zoo Negara, I think they brought in Malayan Sambil for, we did a mastectomy because the animal having a mammary gland tumor. X-ray normally depends. If they can bring the animal to UVH, then we do anything in the UVH lah. If they can't, normally, especially if involve high risk animal, big mammal. So it's difficult to transport. Normally we try to come down to their facility to their premise. This one they do X-ray lah, X-ray the tail of the lion. Okay. Due to the pandemic, we before the pandemic, actually we had some we call a clinical round for wildlife and exotic cases that normally organized by organized by Peritan lah mostly. Yeah? So there are a lot of discussion. But currently we also had a lot of discussion that conducted through the organization that I told you, the WebSIG. The WebSIG also actively involved in doing webinar discussion session. Okay, some of the courses training. This one we work with Bora. Bora also they invited this group from Germany. It's a very famous group from Germany. A group of wildlife conservation researcher. Okay. This is Prof. Thomas Hildebrand. He's an expert professor in Berlin, where he did a lot of research on big mammals like elephant, rhino, in terms of reproduction. Reproduction is good in the ultrasound and so on. This is I can't remember his name, but this is he's a wildlife anesthetist. He's very good in anesthesia. So again, working with wildlife, you need multi practice. Because before you want to deal with animal, you have to knock down the animal. So you need a good anesthetist, and then you need to monitor, and then depend on whatever procedure, what research you want to do. You have to have a mixed practice of you know. Okay, some of the courses that conducted in the local zoo. Courses on how to restrain animal, restraining, management, and so on. All right. This is the end of the first lecture. I mean, first topic. We're going to have another set of topic. So overall, for this course, I would say this is a light course. It's not a heavy course. Okay. So don't worry so much. So far, until last semester, last year, last batch, there's no student fail lah. That's why I said this is a light course lah. You know, to be stressed. So just relax and have fun lah. Okay. You can feel free to contact me at any time, email or WhatsApp lah. But sometimes tu lah, I kadang reply lambat sikit lah. Tapi don't worry, if you have any issues, just personally you can contact myself through my WhatsApp, through my email. Right, thank you. So before I move to second slide, do you have anything to ask?
No, from me, Doctor.
May I know how, well, have anyone pernah went to wildlife practical before this, before the pandemic?
Yes. Yes, doctor, but normally during first year that we went. But
Okay,
for
yes.
third year, we didn't manage to like go under UPM.
Okay, maybe anyone can share your experience, what you did for your wildlife practical for the first year. I know first year nothing, not so much on the medicine, but anyway, you want to share something?
Can I share something?
Yeah, siapa tu?
So we went to Zumelaka and we were under Dr. Villan. So our group,
Okay.
yeah. So we did enrichment toy for the sun bears, which was very interesting. So we had to build something from a bottle so they could put fruits inside and play with it so they get entertainment.
Okay. Malayan Sambe, right?
Yeah.
Okay. I would like to ask you, can you briefly tell me the body condition of this Sambe in Zumlaka? They are, I mean, they are moderate, they are average weight, or they are emaciated, or they are overweight?
I don't think they were not overweight. I think they were moderate. They were in good condition.
Okay. Way back in 2007, I did study. I did my master on Malayan Sambe. I did bacterial study, viral and parasite study. But from my subject, I took Sambe from zoo. Okay, I want to mention lah, from two zoos in Malaysia. Okay, but I found out that one group of Sambe in one zoo, they are obese. They are obese. You know, the average weight of Malayan Sambe is around, I would say around average 40. Okay, average 40 lah, 40. In the wild, lesser than that. You can find adult around 35, but 40 is average lah, 40 kilogram. In some zoos, they have 70, and maximum I got 90 kilogram. So they are really, really obese. Okay, so what I'm trying to tell you that this is very important in the zoo or in any keeping wildlife. You need to manage their diet and nutrition. You cannot simply give anything. But of course, we have to understand, in some zoo, they have some limitation in term of fund, to fund their feeding lah kan. Because as I mentioned, food is is uh, is a major part of the total fund. So yes, I do understand. Some zoo, if when they got supply, when they got apa kita panggil, donation from public give whatever lah, fruits, bread, whatever, so they just give it to the animal without controlling. So that's why it will end up with problem issues like obesity. As you know, obesity may lead to other problems lah, high cholesterol, so on, and then you develop heart problem, hypertension, and so on. Okay, so very important. And then when animal in captive, you have to look at their general observation on the animal behavior. Most of the animal, especially carnivores includes everything lah, include some bear, include tiger, what so on. They tend to develop a stereotypic behavior. Stereotypic behavior is an indication of stress behavior. Especially for bear lah. Bear is easy to look for. Kan? Bear ni kalau you tengok dia facing forward and back, suka nodding their head every time kan. Kalau tengok some bear selalu nodding the head like this. So this is a sign of they are stressed. That's why stress can be managed by many things lah. Okay, you have to improve their entertainment lah, improve their facility in the cage, kan. For example, perhaps before this, some zoo they just practice, just put the food in the tray and then give it to animal, or just put on the floor, so just animal go and eat. So it doesn't nurture dia punya apa tu, natural behavior. Kan behavior sambil ni dia akan searching for food kan. So dia akan ada entertainment lah. You put lah, you make kalau tak ada pokok, you do have any trees in the enclosure, you have to develop artificial tree. Kan? Put lah any trunk, whatever, and then you put the food on top of the tree so that he will climb. So all this can apa tu distract lah daripada dia from boredom. Anyone have experience handling any clinical case in the zoo? Tak ada.
Doctor, I think I remember one time I volunteered at the zoo and then there was an
Okay.
albino python.
May I know which zoo?
Zoo Melaka.
Zoo Melaka.
Yeah.
Okay.
There was an albino
What
python
case?
with skin allergy.
Albino python with skin allergy.
Yeah.
Okay. So you still remember what the clinical sign and why you suspect the animal have some allergy?
I think because the panggil apa skin ke skill lah.
Scale, yeah.
Skill. The skill was like it was like inflamed and it was just macam there was some parts where it's just like falling off. And then since it's albino kan, dia tak ada pigmentation dekat dia punya skin tu. So they're more prone to like the inflammation of the skin and stuff like that lah.
Okay. May I know is a ventral part or what? The ventral part or lateral or on top of the body?
I don't remember. I think there were like patches. Macam,
Patches.
yeah, all over the body, like the dorsal part.
Okay. Is it reddening?
Yeah, ada juga.
Okay. Okay, never mind. Later on, I think you can learn detail during during Dr. Ruben's class on reptile medicine. But in general, okay, for captive animals, normally a major issues of health is not related to infectious disease. Normally, majority related to management related problems. It's not about infectious disease. Okay, it's more about management issue. For example, mismanagement of feeding, mismanagement of environmental, kan? If you notice some, for example, like kalau you observe nanti, you pergi kat zoo, tengok dia punya enclosure, is it enough penetration of sunlight? Is it humid in the too humidity in the cage? So all this can cause further issue. Same thing with reptile. Reptile, they are so sensitive with environmental factor. Okay, reptile is very important. You have to take care of their heat, sunlight, and humidity. All these three is very important. Okay, if miss of this one of this, it can cause a problem. For example, in this case, it could be it could be a scale or skin allergic. It could be, but also it could be also due to uh, uh, poor. I would say it's a environmental issues, which is some of the environment having contaminated, and then they may also stress because of lacking of one of these, maybe lack of temperature, lack of sunlight, maybe too low temperature, or maybe too high or too low humidity that lead to secondary problems. Um, okay, can you see my slide? The scenario of wildlife?
No, doctor. There's only like a sentence saying that you're sharing, but we can't see your slide.
Yeah, I'm resharing. You can see the slide now?
Yes, doctor.
Sorry the online punya issue Okay, just a very brief introduction about our biodiversity in Malaysia. As you're aware that Malaysia is one of the most richest countries in the world in terms of biodiversity. You name it, we have so many things in Malaysia, flora and fauna. Okay, we have so many things. In terms of wildlife, we have so many exotic or wildlife animals. Okay. Same thing, we have the smallest primates in the world. Okay. We have smallest bear in the world, Mensam bear. And we also have a largest flowers in the world. Kan? So that's why we are lucky to have many things in Malaysia. But unfortunately, in fact, earlier we have so many others because of the extinction. We lost many others jugalah. For example, this is one of the sad story lah in Malaysia. Sebab Sumatran rhino. Last time also kita ada Javan kan, Javan rhino. We also had Javan rhino. But Javan rhino earlier lagi dia dah extinct. And currently in 2019, we declared or Sabah declared that there's no more Sumatran rhino in the wild. So this is very sad lah. But before this thing happened, actually we do have captured, we do have a captive Sumatran rhino in Sabah. We have three Sumatran rhino in captivity. And all this actually was run, the conservation work was run by Bora lah. I mentioned earlier the Bora. So this is one of the rhino, Tam, or his full name Kertam. Okay, captured in 2008. But unfortunately, he died. Kertam ni male, female? Male, sorry, male. So the only male Sumatran rhino died in middle of 2019 because of old age. It was believed due to old age lah. It was estimated the age to around 30 years old. The other we have Puntong. Okay, Puntong is a female. But upon captured, they found that Puntong having a three-legged, one leg left forelimb was snapped. It was believed was snapped by the poachers lah. But that one is not the main issue lah. I mean not the main problem to do a conservation. But the problem is she has another issues of she's developing a tumor at it was believed at dia punya gum was originated from the gum. So the problem deteriorated. They try to at first they thought it was a dental issue, but when they do a close inspection, actually not dental issue, but the Puntong having a oral ataupun tumor. So again, it was died the same year. I think I'm not sure bila dia mati. And then last one, Iman. Iman also is a female, captured in 2015. So after Puntong dengan Tam mati, this is the only captive Sumatran rhino got in Sabah or under the Bora punya ni lah. When the animal was captured, the next day they realized they found this thing. It's a massive blood came out from her vagina. Okay, so this is the day one or day one after captured lah. Day one after captured. Okay. So they did ultrasound. They found that the Iman having a multiple reproductive tract lesions. Okay, including they found 2 mass in her uterus. And unfortunately, the last rhino died in the end of 2019. The same year with Tam, 2019. So postmortem revealed that it's truly lah Iman having a mass, dekat dia punya uterus, reproductive tract. So all the mass here. Yeah, I don't want to touch on this. Actually, the routine as a veterinarian, you have to do all this lah. Routine health checkup for animal health lah. Okay. I just want to share what normally we did lah. Normally what we did, and I give some example of cases that we handle. For example, like this one is a case of pneumonia in a river terrapin. This terrapin actually was brought from Botakanan, Perak. The Perhilitan punya, the Wildlife Department punya sanctuary, river terrapin sanctuary in Botakanan, Perak. Complain with bleeding came out from the mouth. You can see, maybe not so clear, but you can see blood stain coming out from the mouth. And we did X-ray of this terrapin, and we found, if you look, this small picture actually, the radiolucent, the dark one is actually the lungs. It's a lung lobes, lung lobes of this normal tortoise. But you look from his X-ray, more than 90% actually consolidated. We suspect this is a pneumonia inflammation. So just imagine how animal can breathe with this lungs consolidation. And at the same time, it has a concurrent egg retention. You can count 8 here. You can see the egg, the eggs. This is already calcified. You can see the outline of the shell. I think there's around, if I'm not mistaken, around 16 eggs. So it has concurrent. When the animal having a problems, they have problems to lay the eggs. So we have to induce the trapping with using the oxytocin. So we induce after 1 hour of induced using oxytocin, the animal able to release the eggs. The problem is that if you keep a longer, we are worried that the eggs will what we call attach together. Then further it will having a problem, difficulty to lay the eggs. Or even the complication also can be a rupture of the eggs. So ruptured, it can cause infection, coelomitis. The case of foreign body obstruction in the Malayan box turtle, this is public. Well, there are so many cases lah of this, especially kalau box turtle, red ear slider banyak, it can be found abundance dekat lakes kan. Kalau you pergi mines tu, there's so many turtles there, and also a lot of fishing activities there. So banyak jugalah they will consume this fishing line. So upon X-ray, we found there's a hook inside the GIT lah, inside the stomach. So we need to do a surgery lah. We need to do this to open the shell and to remove the fishing hook. Okay, a case of rabbits with stone or urolithiasis. Okay, this is quite common in rabbit. In my lecture, I will discuss further on this. So because rabbit, they excrete the calcium majority throughout their kidney. So that's why the calcium sediment will sedimented a lot in the bladder. So without a proper provide water or animal having a dehydration, so it will accumulate this calcium deposit, and further it can cause a clump of the deposit and can cause stone. So definitely in this case, there's no medical management. We have to do a surgical management. That's a big stone there. Okay, this is also example one of the. This one we did a collaboration case with Zoo Negara. Okay, a puma with squamous cell carcinoma at the ear pinna. Okay, they did so many times of surgical removal, many times. I can't remember how many cycles, but so many times. But it keep recurring, So yeah, they do a surgical removal. They do apa tu? A surgical removal lah of the squamous cell carcinoma, but still keep recurring. So when we intervene, we also tried chemotherapy. We tried chemotherapy, but it doesn't work. Not doesn't work. Actually, it has a lot of complication. As you know, if you give chemo drug, it can lead to so many complications like vomiting, diarrhea, and so on. So this one we opt for another technique, which is we give directly the chemo drugs into the cell, into the ear cell, into the ear pinna, and you can see this dramatic improvement after 2 weeks, 1 week or 2 weeks, the treatment. That's why I said in wildlife you need to have more creativity. You have to explore more. As you know, if for example chemotherapy, normally we have to give IV, but for wildlife it's difficult to give IV. Okay, this is a recent case of, maybe you heard about Awang Rasau early this year, because of it was caught by a poachers, suspected by a poachers lah, brought to us to have further treatment, but unfortunately we cannot save this animal because we found that one of the bullet actually hit the spinal cord, and the animal actually is paralyzed halfway. I mean the back legs already paralyzed. So it's not practical to take care of orphan or disabled tiger like this. We try, but we couldn't. We are unable to save the animal. The animal we have to euthanize because of the welfare of the animal. We have to euthanize the animal. Okay, these are conservation work that we have done. I mean, there are so many research work lah in Malaysia. Like myself, I did more on tuberculosis works in wild boar, in elephant, and as well as uh, wild primates. Okay, anesthesia and reproduction works. Okay, behavior study and so on. There are so many works that can be done, and yeah, I think that's it. Any question on this slide?
No from me, doctor.
Anyone pernah pernah join, I mean pernah buat any any clinical techniques? For example, you have experience of taking blood from certain wildlife in zoo animal, for example. Any experience of taking blood from, I know, elephant ke, primates, or any clinical techniques? Anyone can share your experience? Tak ada.
And doctor, I was not involved in any blood collection, but previously before entering the degree, I joined Bora, Dr. Zainal, and some other reps
Okay.
in semen collection for colonials and bears.
Okay, alright.
But
So,
that time I was still not a vet student, so not really like knowing what actually they're doing.
yeah.
But it was a really eye-opening experience.
Okay. So meaning that before you take semen collection, you do semen collection, definitely you have to tranquilize the animal, right?
Yes, doctor.
Yes. So well, so at least you know how complicated, how complicated the things. Perhaps uh, to take semen is one thing. You need special techniques, special methods. But the most important thing is you want to make sure the animal is alive. Okay, dealing with wildlife is risky. As I mentioned earlier, you don't have any idea what about the health status, really the health status of the animal. Normally for domestic, before you want to sedate the animal, before you want to proceed with more complicated surgery, you have to do a baseline check of his health. First, of course, you do a physical examination, you do a general inspection, and then you take blood to have an idea. Look at the PCV level, look at their kidney level, and so on. But for wildlife, you don't have time. You don't have, it's not practical to do that. It's not practical to do that, and this is difficult to assess that. So that's why you have to take a risk by generally looking at animal. Okay, this animal is healthy, then we just knock down the animal. But in some cases, most of the case it works, but some of cases we face some issues lah. I personally have a few occasion where we were trying to tranquilize some animals, but unfortunately after that animal died. So we don't know their health status. When we cut open, immediately we do postmortem, then we found animal having a problems. So all this, so I said it's a risk, high risk when you deal with the animal. Just imagine last time we want to translocate apa tu banting from zoo negara to zoo Singapore. Before that, we need to do health checkup. So we want to tranquilize the animal just to take a blood, just to take a blood. But right after we tranquilize the animal, mati. Right. So that's why we immediately do postmortem. We cut open the lungs and we found the lungs was bad lah, having a pneumonia. So that's why it's reflected to drug that we use that normally, for example, you use a xylazine, for example, to knock down the animal. Okay. So xylazine is a very bad effect to the animal having a lungs issue. But the problem is we don't know. We don't know the health status. It's difficult to monitor the the exact health status of the wild animal. And further, if you deal with more exotic, for example, if you deal with Malayan tiger, it's much more challenging. If anything happen, you have to defend why animal die and so on.
Doctor, I have
Yep.
question. Like, does using wood shaving as the bedding, right, increase the chances of pneumonia? Because back when I was doing my internship in Zoo Taiwan, like they have around 42 death of this pangolins, right?
Pangolins.
Most of them are due to pneumonia. So like, just wondering whether the wood shaving increases the chances of pneumonia because they are very fine particles and they're always in there.
Oh, okay, right. Uh, to be honest, I'm not really sure about how to answer this, but it can be the source of infection. I mean, the wood shaving be the main cause, but the secondary infection actually make the things worse. That's why in this case, well, to get the answer is normally, that's why not to say try another, you need to try to change, for example, to try to change the wood shaving, and then we see the outcomes. Okay. But again, I would say that it can be the source of the infection because of, you know, wood shaving. Some of the wood shaving, they are too dusty, for example. When they are too dusty, and when the plus with the microenvironment, maybe the high humidity will make the problem worse, or even the aeration in that enclosure is not so good, so it will give more problems together with the problem of the wood shaving. Okay, that's one thing. Second thing, again, you need to check how frequent they change the wood shaving. Okay, because the wood shaving also can be a source of infection because it traps many things, especially their own waste disposal, their excretion kan, their feces, their urine. So if you less if you not frequently change the bedding, it also can be source of infection, especially when the wet apa tu wet heavy, it traps many things. Yeah, you talk about a lot of mortality. You need to really discover the main source lah, because for example 40 pangolin dies in a short period of time. There's something you need to really
Oh,
take
sorry,
care.
it's over the span of like 5 years or 10 years,
Oh,
I
I
think.
see, I see.
But yeah,
Okay.
but
But
it's all due to like mostly due to pneumonia.
okay, but do you find any isolation of bacteria or what, or anything infectious?
Because I was in diploma that time, so I wasn't too sure about all these.
Okay, okay,
Yeah,
okay.
so but I know the cause of death is just due to pneumonia. Yeah.
Yeah, that's what I said. Pneumonia normally is due to infection, but it could be a secondary to the primary lah, due to which area.
Doctor, actually, we have a classmate that has experience with like clinical cases in zoos. Yeah, Kavin, check up.
Yes.
So, hi doctor, I'm Kavin.
Y- Yes.
Um, about blood collection, maybe I can share experience collecting on uh, snakes, pythons, and also crocodilians.
Okay, good. So, where's normally you get blood from snakes?
Ventral midline near the tailwind.
Natural midline.
Yeah, and
How is
for crocs, usually the post-occipital sinus near the
Oh,
spinal vein.
okay, all right. So, in terms of difficulty, can you range the difficulty? Is it easy, moderate, or difficult?
The difficulty in these animals is because unlike other animals, you don't you don't have the visible vein. It's blind poking and then and then wishing that you will find the vein
Yes,
and just manual until you find the vein.
yes, that's true. That's true. For reptiles, normally not normally, you don't see the vein. Huh? You can raise the vein. So that's why you know the location, then you just do a blind lah. But yeah, it depends. Normally if a bigger size should be no problems. Normally we having a problem with small sizes. For example, macam like small one macam bearded dragon. Bearded dragon pun if more than 300 gram should be okay, but lesser than that it's quite difficult to get. Like we can get blood, but not much lah. Okay? But for green iguana, for crocs shouldn't be a problem lah. Or big snakes shouldn't be a problem.
We did once with a very small chameleon dog,
Chameleon. Mm.
and then we tried to raise the weight and we couldn't, so we ended up getting from the heart. Mhm.
Okay, and in first place, is it why you take the blood? You want to screening or or animal having a problem?
Animal was having a problem, so we wanted to see the parameters before giving drugs. We didn't have the gas machine, so we couldn't mask it down. We had to give injectables, so we had to see the parameters before.
Okay. So you give injectable of what? May I know what kind of drug you use?
I think that time we gave, if I'm not mistaken, we gave medetomidine with another drug.
Mm.
I'll get back to you, doctor. I forgot the
Yeah.
drug name.
Okay.
Yeah.
So animal is totally knocked down or just in the sedation state?
In the sedation state. It was quite old. It was fourth or fifth cycle and had egg binding issues. We
Ah,
together with gouts and other issues. So we couldn't risk to knock it down completely.
okay. So you see, still the issue lah. I mean, although you want to take a blood kan, but you have to use sedation. But sedation also can is also a risk to an animal. Okay, especially for reptiles. Reptiles, they can slow down their physiological. Okay, if you give sedation, it go down lagi. That's what we worried. If they go down below dia punya normal physiological status, is sometimes quite difficult to revive the animal. Or animal can be revived, but it can take some time. We had experience of to revive a snake. We use a zoltil, for example. Last time we used a zoltil in king cobra. It wake up after 7 days. It wake up after 7 days because reptiles they have special. They can reduce their physiological state below the normal. Not to a level of hibernation, but below, yeah, something like that. Okay, so that they stay alive, but breathing maybe once in, I don't know, once in 1 minute, or dia punya heart rate maybe 2 to 5 in 1 minute, or even slower than that. But still, they still get alive. Just their heart rate, their respiratory rate, just enough to to give their energy just to alive. Okay, that's why uh, we also had an experience of dealing with these reptiles. It's not easy, especially for anesthesia in reptiles. It's not easy. It's very challenging. All right, thank you, Kevin.
All right.
Doctor,
Yeah.
we were wondering whether we can have any like physical classes because we'll be going back during our 4th week during November. So yeah, we were wondering about that.
Okay. All right. Maybe we can take time to discuss on this. All right. So you are coming back on 4th week.
Yes, Doctor.
Yeah.
8th of November.
Okay. 4th week. Okay. Kalau 4th week tu dah masuk my lecture kan. Okay. Kalau for my lecture, I think I can consider on face to face. That's not a problem. Cumanya we have 2 groups. I think the most feasible room actually DKVC as stated in the schedule kan, DKVC. But you have to bear in mind if we pull everyone in DKVC, we are able to have apa tu distancing this 1 meter memang tak boleh lah sebab you all pun ada lebih kurang 100. So I don't think if we can cope with that, I think should be okay. Tapi itulah kena make sure everyone yalah pakai mask apa semua lah. Sebab kalau kita nak buat social distancing memang tak cukup lah DKVC. Okay? Unless kita we make it hybrid lah. Mungkin kita take turn lah. Mungkin this week half student datang, half followed through online. We going to have online also lah. Tapi siapa yang datang, itulah macam mana kita kena discuss dulu lah. Kalau nak pull semua datang in DKVC boleh tapi we have to bear in mind ada penjarakan lah.
Okay, doctor, maybe we can discuss it further down the line.
Yeah, you discuss dulu and then you also refer to other lecturer, other courses lah. How they do their face to face. Okay? Because unless kita diberi auditorium should be okay, but I don't think auditorium applicable. So that's why we have to depend on the KBC lah. Okay?
Okay, doctor.
Alright, we can discuss further nanti ya. Alright, that's all for today. Thank you very much. I will pass this lecture notes to Yuki later on, and I will also upload into the Putra Blast later lah. Okay. Alright, so please Yuki, for next classes, make sure you contact apa tu? Contact all the lecturers directly lah. Tanya dia orang boleh tak nak buat online ke whatever. Confirm that with them lah.
Okay, doctor. Yes,
You have their numbers, or you can just email them. I will give their number later on to you.
Okay, doctor. Thank you.
Okay, so thank you Yuki, thank you everyone. Have a nice day.
Thank you, doctor.
Bye.
Thank you, doctor.
Bye.
Thank you so much, doctor.
Bye.
Thank you, doctor.